Good morning. So we have a total of 20 minutes, 15 minutes for me to lead you through a meditation, and 5 minutes to frame the next session after the meditation. I'd like you to sit as comfortably as you can, relatively erect backs, uncross your legs, and have your hands open in your lap. So in wisdom traditions, there are 5 aspects to meditation, okay? Self-reflection, which is basically asking questions of yourself and listening to the answer that comes from the deepest part of your being. Self-awareness, being aware of any aspect of yourself, your body, your breath, or even the observer of awareness. So right now, for example, as you're listening to me, just turn your attention to who's listening. So as you're listening to me, be aware of who's listening. See that still awareness? That's your core consciousness. So self-awareness. The third is transcendence, which is to go beyond thought altogether, which we won't have time for today, to experience your non-local identity, your cosmic identity. The fourth is conscious choice making. And the fifth is understanding the difference between the perceptual and the more fundamental. Your body is the perceptual experience of consciousness and all the choices it's made thus far. So let's close our eyes, and I'll lead you through 2 or 3 aspects of reflection and awareness, okay? So the first thing that you do is you bring your awareness into your heart space, which is right in the center of your chest. And you have an attitude of deep listening to questions that you're going to ask yourself. And since we're talking about health matters, I think we'll reflect on health matters. So ask yourself, what vision do I have for my own well-being for the rest of my life? What vision would I like to have for my own well-being? And then just listen. And allow any sensations, images, thoughts, feelings to emerge. Second question, what vision do I have for the well-being of my country, of the United States? And again, having asked the question, deep listening, and allow any sensations, images, feelings, or thoughts to emerge spontaneously. Third question. What vision do I have for the well-being of planet Earth, this beautiful planet floating in the seas of space? Spaceship home. And once again, allow any sensations, images, or feelings to emerge spontaneously. And the fourth question, how am I going to participate in the realization of this vision? How am I going to participate in making this vision reality? And once again, listen and allow any sensations, images, feelings, or thoughts to emerge. Okay, we're done with the self-reflection. Now self-awareness. So keep your eyes closed and become aware of your whole body. All at once. Your body is a field of awareness. And now please become aware of your abdomen and the hollow viscera in your abdomen. Just bring your awareness to that part of your body. Now become aware of your chest and the movement of lungs inside the chest. The spontaneous movement of your lungs and diaphragm. Just be aware of it. Now bring your awareness into your heart, right in the middle of your chest. And with a little focused attention, become aware of your heartbeat, either as a sound or as a sensation. Once again, become aware of your heartbeat with a little focused attention as a sound or as a sensation. You should be able to feel your heartbeat. Now bring your awareness into your fingertips. Hopefully your hands are open, pointing upwards. And see if you can become aware of your heartbeat and the throbbing of your heart in your fingertips. You should be able to feel it. A throbbing, a sensation, some tingling, something. As you do this, please know you're increasing blood flow to your hands and therefore lowering your blood pressure as well, just by simple awareness. And finally, for the next part of our meditation, and the simplest part, allow your mind to settle into your breath. No manipulation, just allow your mind to settle into the movement of your breathing. And notice how it becomes still as your consciousness or your spirit or your awareness merges with the breath of life. Just allow your mind to settle into your breath. Okay, you can let go, relax into your body, and take about 5 seconds or 10 and open your eyes. So that was very simple reflection, and awareness. One can, of course, extend it all the way into the cosmos. In the next 5 minutes, I'm going to frame the next session, which I'm sure will be delightful. I noticed my friend Dean Ornish, who's made such a big contribution to this whole realm, is going to be part of that discussion. So if I was to say one thing about well-being and lifestyle, I think one thing that you should understand that will inspire you, because a lot of people are motivated to change and they don't, okay? So if I can say one thing that will inspire you, and that is that your body is not a noun, it's a verb, okay? It's an activity, and it's a dynamic activity. And the body that you have right now, that you are sitting in this room to listen to this talk, is not the body that you came in with a little while ago when you came into this room. Even with one breath that you breathe in 10 to the power of 22 atoms from the rest of your environment. With every breath you breathe out 10 to the power of 22 atoms that are coming from every single cell of your body. And at a fundamental level, we're all exchanging our molecules and our bodies with each other very intimately. Our bodies are part of an ecosystem, and they shift in every second as a result of everything that we experience. Everything that we experience, our thoughts, our feelings, our emotions, our personal relationships and the quality of those relationships, our social interactions, our environment, they're all part of this dynamic activity. Even your genes, not nouns, they're activities. Dean Ornish and others have shown that within a few 4 months of changing how you think, feel, behave, and interact with the world, you can turn on 500 good genes and turn off 500 bad genes. Your brain is not a noun either. It's a dynamic activity. With every thought and feeling, there's a neural network that goes into action. And that neural network is created by you. And so we have a deep understanding of the relationship of our mind, our spirit, our brain, our body, and our environment as an activity of nature. In science, we usually look at nature from the outside, but actually we are nature also. And to participate in that dynamic activity that we call our brain, our body, our genes, is a very exciting process. It's exciting to know that, every time you escape being threatened or get rid of the perception of feeling threatened, you override your reptilian brain. Every time you feel love, kindness, joy, peace, equanimity, you activate your emotional brain, which actually influences your endocrine system and the feedback loops that create for well-being. Every time you are inspired, or you have insight or intuition or imagination, or you express your creativity, you activate your cortical brain that allows you to reach more expanded states of consciousness. So I don't like the word motivation because I've noticed that nobody actually does anything after being motivated. They join the gym, and 3 months later, they're still paying their fees, and they're not going to the gym. The word I feel is important, which I think is the key to transformation, is inspiration. As the word itself implies, inspiration means to be inspired, to be in spirit. And when you're inspired, then there's no going back. Absolutely no going back. And so again, coming from Eastern wisdom traditions, but having the training in biological medicine, I think you need to inspire yourself to have a dynamic, rested, alert, joyful body and a clear mind with total clarity and vision for what it takes. And you already know this. That's the beauty, that your inner self knows everything. There's no need to go to seminars or lectures or read books. There's an inner intelligence within you that is the ultimate and supreme genius that mirrors the wisdom of the total universe. And to tap into that inner wisdom is to make changes very spontaneously, very joyfully, and to be inspired. So our next session is to that deep understanding of our bodies and our relationship to the universe as a dynamic activity, as a verb. Thank you.
In many ways, the 21st century is a great time to be alive. Never before have we had so much access to tools that can help us enjoy healthier and longer lives than previous generations. From fresh food retailers to gyms and fitness clubs, from cutting-edge technology that extends life and cures disease, to the ease with which people can now access information about healthier living. And yet, the resources to live a healthy and productive life are out of reach for millions of Americans.
If people live in communities where there are no grocery stores and they don't have easy access to transportation, it's less likely that they're going to consume 5 servings of fruits and vegetables per day. If people live in communities where it's not safe to go out on the street, let alone jogging or walking, they're less likely to engage in those behaviors in the area of physical activity that we prescribe.
Approximately 24 million Americans live in food deserts, having to travel more than a mile to buy fresh meat, dairy products, and vegetables without the advantage of a car or viable public transportation. Around 70 million Americans do not have personal access to the web, so have no one-click access to healthcare information. 48 million Americans had no health insurance in 2011. The wide disparities were highlighted at last year's Health Matters conference. Health and wellness advocate Nota Begay pointed to the challenges faced by Native American communities.
Most services on reservations are inadequate. Less than 10% of Native Americans that live on a reservation have internet access. There's in some communities in Navajo Reservation, I think close to 50%, actually I think it's 40% don't have running water. And so we're still living in what you would classify as third world conditions, right in the wealthiest country in the world.
Clearly, there's still a lot to do if we are all to live healthier lives and end healthcare disparities. The good news is that many of the solutions are known. We are here to demonstrate the power of collective action.
Thank you. Thank you, thank you. I want to start with potato chips. Not to eat, but Americans spend $7 billion a year on potato chips. We spend $73.9 billion on carbonated soft drinks, and we spend $110 billion on fast foods. Not only does that contribute to heart disease, but our country can only find a fraction of that sum to spend on research to combat it. The NIH invests less than 3% of its budget on heart disease, when 30% of the population dies from it. Yet most people are not aware of these facts. About 39,520 women die of breast cancer each year in the United States, as compared to around 455,000 women who die of heart disease. I became committed to doing this work in 2007 when I learned that heart disease is the #1 killer of women in the world. It kills more women than men, and it kills more women than all cancers combined. Yet most people are not aware of these facts. I also learned that nearly all of the cardiac research studies funded during the past 50 years have been done primarily on men. And needless to say, there are physiological differences between men and women. We have different plumbing, and oftentimes heart disease presents very differently in women, and yet most people are not aware of this either. So, as a member of the board of directors at Cedars-Sinai Medical Center, I am thrilled to announce that the hospital, through the Barbra Streisand Women's Heart Center, is pledging $2 million to launch a national campaign to address issues of awareness, prevention, and advocacy as related to women's heart health. This is good. Dr. Noel Bairey Merz, the brilliant director of the Women's Heart Center, will be a part of the panel of speakers today, and she'll share in greater depth how the center is helping change the way women are diagnosed, treated, and educated. Before I return to my seat, I want to thank President Clinton and his foundation for creating this forum, providing leadership, and highlighting important issues in the field of wellness, health, and disease prevention. The pledges made during this conference will undoubtedly impact many lives for years to come. Thank you so much.
Ladies and gentlemen, please welcome Chelsea Clinton and panelists.
Thank you, and thank you, Barbara, and thank you to all of our panelists and questioners this morning for getting us off to such a terrific start and for providing the perfect segue in many ways to this panel now, talking about increasing access to healthy lifestyles and its corollary, though silent because it's a little bit more politically uncomfortable, how to decrease access to unhealthy lifestyles. Before we start this panel, I'm going to ask each of the panelists to talk a little bit about their pledge and ask the woman to my left, Dr. C. Noel Bairey Merz, to kick us off. She is the director of the Barbra Streisand Women's Heart Center, and I hope that, Noel, you'll elaborate a little bit on Barbara's announcement.
Absolutely. I have a cold, so I don't typically sound like Kathleen Turner, if you've heard me speak otherwise. So yes, I do direct the Women's Heart Center, the Barbra Streisand now Women's Heart Center. I also direct the Preventive Cardiac Center, so I'm well suited to address the goals today. We've worked for the last 20 years in biomedical research to close the gender gap whereby women now are the majority of heart disease victims and deaths in the United States, a clear flip from previous decades. And one of our key findings has been to identify female pattern heart disease, which is not in the textbooks and not being recognized by our healthcare providers. That said, our 20 years of work, still we are at least 35 years behind the knowledge that we know about men's heart disease. And that's predominantly because research was done in men, for men, and by men.
And now it's being done by women?
It's now, well, and it's also being done by enlightened men. But we're studying women for the first time, and we have for the last 20 years. And again, I'm optimistic. Barbara joined our team and endowed our center 5 years ago. We are hoping to close a 35-year gap in less than 35 years with her support. Why am I here today? Because of the simple adage, if you have a big problem, ask a busy woman. And one of the things that is clear in our Women in Heart Disease campaign is women have often changed medical and social problems. Our best example is Mothers Against Drunk Driving. And after decades of senseless, preventable deaths occurring, despite a lot of effort, women, mothers, made change. They made law changes, they got societies and communities to enforce the laws, and they changed culture. My young adult children now would no longer get into a car after having a drink, and that is a big change from previous generations. So women can do this. We will not be able to change the face of cardiovascular disease in our country until we change women. The personal needs to become political. Number one, women need to know that heart disease is their leading healthcare threat for them personally and to their family. Awareness is at 50%, and because of our efforts, it needs to go up. And then advocacy, and our Barbra Streisand additional pledge will help us help shape our local communities, our state and our federal laws, policies, and advocacies so that women, the mothers of the world, the women in all of our lives, can actually help our families eat those fruits and vegetables and do the exercise.
Terrific. Thank you, Noel. Tim Finchem is the PGA Tour Commissioner, and indeed, depending on your hierarchy of why you're here, as my father mentioned earlier, he might be the main event. Tim, we're thrilled to partner with you on this conference, and we're so excited by all the work that you're trying to do at the PGA Tour to put health more at the center. Could you talk a little bit about your renewed pledge today?
Thank you, Chelsea, and congratulations to you and your dad and all the work the foundation is doing. We're excited about it. And just to put this in a little bit of context, health and fitness and lifestyle has been a growing part of the culture of the PGA Tour for a good number of years. Obviously, our athletes are absolutely focused. There's been so much written about the change in what a golfer looks like today at the professional level than 30 years ago. Although Gary Player has always been an exception to that from the 30-year period. But I noticed the president said this morning, he talked about enlightened companies or companies that take steps to make change for their own people, then maybe the community, and then hopefully the country. And we like to think that we're moving in those directions. Internally, health, wellness, good choices are part of what we're all about. And when we teamed up with Humana with their Vitality program to actually test our employees and screen our employees for issues, we're delighted. We were delighted last year when Humana named us their #1 company because 97% of our employees participated. It's a voluntary program. And the thing that struck us about that, we've been talking for years because it's just common sense that if an employee eats right and takes care of their body and exercises, they're a better employee. But what struck us about this program, the Vitality program of Humana's, was the interrelationship between getting this feedback within 5 minutes and then making behavioral change. And we saw it with our employees. And so we have gone to other levels now. We have exercise programs. We have walking programs around our campus. We have doing a lot of stuff with food for our employees during the workday, et cetera. And we're not where we want to be, but we're making an awful lot of progress. On the community level, in Northeast Florida last year, we announced a $50 million commitment from our tournament, the Players' Championship, to focus on youth. And youth by education, youth by character development, and youth with health issues. And there's an awful lot going on, as there are in a lot of communities around the country in Northeast Florida, with education. KIPP schools, charter schools, Teach for America is very robust there. We have a hotshot new superintendent from Miami who's doing great things in a short period of time. But we felt that coming out of last year's conference here, we wanted to make sure that we incorporated health matters into that dialogue and into those initiatives that are coming forward from those folks coming together. So our pledge today is in two parts. The first part is that we will fund a coordinator, a convener, organized by the Clinton Foundation to work to make sure the community is coming together on these issues and focused on these issues. We look forward to a town hall meeting featuring your dad to raise the level of awareness and get people talking to each other. And we think that the combination of those things will have a real impact. And then the second part has to do with the national level, because, and that's in two parts. We are, as a sport, obviously, we have more hours on television than any other sport. I don't know if people realize that. NFL has the highest ratings, but we reached 160 million Americans last year, and we index week in and week out higher with decision makers than any other programming on the air by a pretty good margin. Decision makers in companies, decision makers in the public sector. And so what we want to do is take some of the messages and best practices that come out of these conferences and working with the Health Matters Initiative and bring those home to America through programming. The second thing is that last fall, we concluded a $100 million campaign to escalate the First Tee program. Many of you are aware of that program because it takes golf and reaches out to people who historically haven't had access to it, largely for socioeconomic reasons. Through last year, we had reached 6 million people. 6 million kids have been through that program. In that program, we teach core values. But last year, we added to those core values a program called the 9 Healthy Habits. And through the $100 million campaign, which was successful, we will reach, in the next 7 or 8 years, 10 million more kids. We're in 5,000 public schools now. We'll be in 10,000 through this campaign. And when we reach those 10 million kids, we will be reaching them in addition to core values, the 9 core values, honesty, integrity, et cetera, also the 9 healthy habits. So we feel like we're doing a little bit here to help. And as we do that little bit, we're coming to these conferences and learning a lot, which is steering us in the direction of hopefully being able to do more. Thank you.
Thank you so much, Tim. And someone who certainly has taught me a lot about preventative health and has been talking and advocating about preventative health well before it was so chic and current to do so is Dr. Dean Ornish, who founded the Preventative Medicine Research Institute at the University of California at San Francisco, which he still runs today. So Dean, would you tell us a little bit about what your next innovation is in the field of preventive medicine?
Well, thank you. I feel honored to be here with you and with President Clinton and my distinguished colleagues and all of you. For the last, I guess, 35 or 36 years now, I've directed a series of studies showing what a powerful difference changes in diet and lifestyle can make. You know, we tend to think of advances in medicine as being a new drug or a new laser, something really high-tech and expensive, and we often have a hard time believing that these simple choices that we make in our lives each day, like what we eat. We use a whole foods, plant-based diet, but also we found that the more you change, the more you improve. Moderate exercise, like walking, stress management techniques, and perhaps most important, the social support and intimacy and love and community, that these approaches can not only help prevent most chronic diseases, but actually reverse them. We were able to show for the first time that even severe heart disease could be reversed by making these changes. Instead of getting worse and worse, people can actually get better and better. And the more they change, the better they get. We found that early stage prostate cancer, we've done the only randomized trials showing that early stage prostate cancer may be stopped or even reversed by making these same changes. Type 2 diabetes can be changed. When you change your lifestyle, it actually changes your genes, hundreds of them within just a few months, turning on the good genes that protect us, turning off the genes that promote prostate cancer, breast cancer in women, diabetes, heart disease, and other conditions. We're using these very high-tech, state-of-the-art measures to prove the power of these very simple and low-tech and low-cost interventions. And we're finding that even your telomeres can get longer, the ends of our chromosomes that control aging. So as your telomeres get longer, your life gets longer. And so often people say, oh, I've got bad genes, what can I do? Well, it turns out you can do a lot and much more quickly. These processes, as Deepak Chopra mentioned earlier, are so much more dynamic than we once realized. We can show these changes very quickly. And these approaches are not only medically effective, they're also cost effective. We found Highmark Blue Cross Blue Shield found they cut their overall healthcare costs by 50% in the first year, and Mutual of Omaha found they saved $30,000 per patient in the first year. So when lifestyle is offered as treatment, you can see those changes very quickly. We also have been training through our nonprofit institute over 50 hospitals and clinics, from the Cleveland Clinic, one of the largest on the planet, to small rural hospitals in West Virginia. And we're finding we're getting 85 to 90% adherence to this lifestyle intervention after a year, bigger changes in diet and lifestyle, better clinical outcomes, and even larger cost savings. We also are training the St. Vincent de Paul homeless shelter in San Francisco in our program. Over 20,000 homeless patients have been through there, and now we'll be cloning that throughout the country. Now, that's important because we're having this debate going on in Washington now about how do we deal with the deficit. You know, it turns out that 3/4 of the $2.8 trillion in healthcare costs, which are really sick care costs, are for chronic diseases that can be largely prevented or even reversed by making these changes in lifestyle. And so we have many Republicans saying let's just dismantle Medicare or reduce entitlements, some Democrats saying let's just raise taxes, let the deficit go up, and there's not a lot of overlap there. That we're saying if we can address the more fundamental causes of why people get sick instead of literally or figuratively bypassing them, we find that we can have better health care available for more people at lower costs, and the only side effects are good ones.
So, Dean, maybe we should send Washington to see you. Ryan Sistare is the Renaissance Hotel Complex General Manager in Fort Lauderdale, Florida. So, Ryan, what brings you out here to the Coachella Valley today with us?
Well, thank you, Ms. Clinton, and thank you, ladies and gentlemen, for allowing me to take part in this. I guess if there's a hierarchy and he's at the top, I'm kind of close to the bottom. Unless anybody needs hotel rooms in Fort Lauderdale, then they'll probably come see me. But I'm here representing an organization called HEI Hotels and Resorts. We are a privately held company. We have 45 hotels in 16 states and over 5,000 employees. And I'm going to kind of frame this, my brief 5 minutes that I get to talk about access and healthy lifestyles, by quoting one of the most difficult bosses that I've ever had. And we were out to dinner one night, and I presented him with all these great plans of how I was going to change a hotel, and he looked at me and said, Ryan, change is great, and until it affects you. And it really sunk into me. You got to think about that. But to change shifts here, I'd like to take a completely unofficial poll. And yes, you will be judged by those around you, and I encourage my panel members to raise their hand as well. Is there anybody in the room here who had a professional athlete or a movie star as a hero growing up? I can see you through the lights. Trust me. I know you're there. All right. For all of us who raised our hands, we are completely different from the line-level employee in a hotel. I'm going to give you some global statistics. According to the Hotel Motel Lodging Association, the average education of a hotel employee is the 4th grade. According to Tufts University, 60% of all immigrants in the United States and gateway cities work in hotels. In addition, in a John Walker text entitled Supervision in the Hospitality Workplace, he indicates that we are the leading employer of minorities in the United States. Now, that's a pretty sobering fact. I'm not sure who really watches the CDC statistics every year, but last fall they came out with a statistic that African Americans lead the population in obesity at 49.5% of their population. This is closely followed by Mexican Americans at 40.5%. And these are our employees. So in 2010, things changed. They really did. And I kind of want to use my company as a microcosm as to what can be accomplished. First of all, as we all know and we can all respect, healthcare costs continue to rise. In 2010, it became so burdensome to both the employee and the employer that we figured that the only way to make a change was to change behavior. So the first thing we did is we partnered with Cigna Healthcare, and we came up with a consumer-driven insurance program. And I know there's a lot of health insurance people in here, but for those of us in the hotel industry, this is very, very unique. In fact, we're one of 2 companies that are currently taking this program. Through our tools, you can go online, you can shop for any sort of procedure, and we kind of joke about shopping for a heart surgeon. But really, the level of clarity of where your insurance dollars are going to a non-healthcare worker is absolutely staggering. Then we offer, as many of my colleagues have said, complimentary biometric screenings for all of our employees. during these screenings, you can get everything from your BMI, your blood pressure, and other key statistics. And more importantly, we give you ways to make these things better. We offer something we call the Employee Assistance Program, and this is for life-changing events. And this is everything from legal advice to marital counseling to financial advice, anything we can do to help our associates. Because a happy and well and fit associate is more productive, and you get better bottom line results and long-term results. Now, I did want to point out something that I said that all of these items are complementary. They're complementary because we believe that the uninsured and the underinsured should get the same access as those of us who have insurance. Now, we took things to a different level. We started going down from the macro level to the micro level. We changed our employee meal program. Simple things such as changing the plate size. We went from a 9.5-inch plate to a 7.5-inch plate. So less you can put on a plate, less you can eat. We've mandated more nutritious menus in all of our hotels. Now, I'm still trying to get my team to catch on to what quinoa actually is, but slowly but surely, I'm winning them over. So I'm painting a pretty rosy picture here, okay? I want to give you some aggregate results. But then, like I said in the beginning, things can be painful. So let me give you the good news, and then I'll give you the bad news. The good news is in our first year, we lowered the number of people with high cholesterol from 10% to 2.9% in our population. And in terms of high risk, and these are people that we consider to be people that would have a fatal disease, we lowered from 17% to 10%. And my favorite statistic at all is we lowered the number of smokers in our population from 20.5% to 10%. And this is all in the matter of a year. So, we're back in 2012, and the chairman of our company, a gentleman named Mr. Gary Mandel, who you'll hear from later today, attended the Clinton Initiative, and he actually came back to us and said, guys, we've done well, but I want a commitment to action, because that's what the Clinton Initiative is about. I want a commitment to action from each and every one of you as it relates to wellness. Now remember, we have 5,000 employees. I will tell you that to date, we have 1,200 commitments to action to wellness. Now this could be everything from losing 10 pounds to seeking psychiatric care when you need it. And again, we have the tools and resources available to get you there. So here's where things get really personal. When I was 12 years old, I actually saw my father experience his first heart attack. Now, as a father myself, I have 2 young boys, and I married my high school sweetheart who continues to keep me around, and I think she wants to keep me around. So I made a pledge to make myself heart healthy. That was my commitment to action. I'm down 42 pounds, and this is over the course of 6 months, and my cholesterol levels are astounding even to my doctor. So thank you, but thank you. It was for me. It was for them, not for me, by all means. But I've got an even better story for you. There's an individual that works in my organization, and her name's Cherry. Cherry lost both her husband and her mother the same year. And I'm really quoting her in this. She followed in the following year, she spent it in bed drinking cheap Chardonnay and watching reruns of General Hospital. All right? So Cherry, for lack of a better term, was a mess when she came to us. Her commitment to Gary was that she would use every single one of the programs that was available through HEI to become a better person. All right? So to date, Cherry's off 3/4 of her medication. She's lost 50 pounds. And not that age makes a difference, but Cherry's a good 20 plus years my senior. She's dating a very nice gentleman who's 5 years my junior. So I'm telling you that it works.
Well,
so in the end, my job here was to tell you about the successes. But what I really wanted to do is I really wanted to challenge each of you to make a pledge or a commitment to action to make access to healthy lifestyles part of your workplace or organization. And if you can give me one story as good as Cherry's, it probably would have been worth your time. Thank you.
thank you, Ryan. Andrea Thomas is the Senior Vice President for Sustainability at Walmart, another company I know that takes health and wellness very seriously for your employees, but increasingly for your customers as well. Will you talk a little bit about Walmart's pledge today, but also kind of the really transformative work that you've done in your company and in your stores?
Sure. So as we think about how to help our customers, we really spend a lot of time understanding their lives. We've got about 140 million people that come into a Walmart every week. Many of these people have really complicated lives. They're on very tight budgets. They have multiple jobs. They have challenges from a health perspective. And when we talked to them, there were a couple things that they brought up that were real barriers for them eating healthy. For a lot of people out there, they talked about food deserts on the videotape. Having a store that's too far away that you really can't get fresh food was a barrier. Price is a barrier for a lot of our customers. They really felt like fresh fruits and vegetables and the healthier foods were more expensive. And understanding what a healthier choice is something that can be more complicated if you aren't spending a lot of time really understanding that. And so we made a commitment 2 years ago that I'm going to talk a little bit about, and then one that we've made recently that's kind of an extension to that. So 2 years ago, we made a commitment that we would make healthier food more affordable and more accessible to our customers. And there were 5 major ways that we were going to do that. The first was really about fruits and vegetables and price. And so we committed to save our customers $1 billion a year when they bought fresh fruits and vegetables at Walmart versus when they would buy them anywhere else. So we've been tracking that, and this is the end of our second year, and for the second year in a row, we've exceeded that number. So
how have you done that?
So there's several ways that we've done that. We've done it by doubling the amount of locally sourced produce. We've done it by decreasing waste and spending a lot of time focused on the distribution center or system around healthy fresh produce. And then we've actually communicated, I think, how people can choose fruits and vegetables and use them more in their diet so that we can help them kind of get used to buying and using. Because it was really, if you're on a really tight budget and you're counting every penny and you buy and then you have to throw something away, you don't want to buy it again. And so we've been working on really helping them become more familiar with how to use fruits and vegetables in their diets. So we've also been focused on reformulating many of the common packaged foods that they buy, and we committed to decrease sodium by 25%, decrease added sugar by 10%, and remove all the remaining industrial produced trans fats. And so that is taking out all the partially hydrogenated oils. And so we're tracking our suppliers, and so we've identified the categories, and we're doing a survey, and we have back from them information on the formulations of their products so that we can track what's happening from a reformulation standpoint. One big initiative that we undertook is a very simple front-of-pack icon on our private brands to help our customers know what a healthier choice is. And so we met with a lot of external experts, doctors, nutritionists, members of the government, people in academia, and we worked for 2 years on a definition of healthy or healthier. And so in its simplest form, and we've made it very transparent and accessible to everybody on greatforyou.com, but walmartgreatforyou.com, but you have to include a whole grain, lean protein, low-fat dairy, and you get excluded if you have too many saturated fats, too much sodium, too much added sugar. So we made a pretty simple definition, and then we just put the icon on our private brands, and we're in the process of rolling that out, and 1,300 of our private brands will have this icon on the front of the package. So when you're shopping up and down our aisles, if you go in front of pasta, you'll see the whole wheat pasta has the icon, and the white pasta does not. You go to the dairy case, you'll see that the skim milk and the 1% has it, the other milks don't. And so it just helps you navigate when you're really busy and you don't have a lot of money.
Are you seeing people's purchasing patterns change?
We're still rolling it out, but one of the things we're really excited that we're tracking very closely is that we've partnered with Humana Vitality, and they are offering their Vitality Healthy Food, which is an initiative that they can sign up for where they get a 5% discount on the Great For You items. So we just announced that in September, rolled it out as of the 1st of January, and we're going to be tracking that very closely. So we'll be able to watch the shifts. And then very quickly, we've built 50 stores in food deserts that we've opened already. We've got a commitment for 200 additional in the next several years, and our foundation has donated $18 million for nutrition education for things like helping people shop, learning how to cook, and so all of these together, we're 2 years into a 5-year commitment, and we're working very closely with our suppliers. Our associates are obviously part of this, and then we're working on with a lot of great partners in the foundation to help on the education side of it.
Thank you, Andrea. Dr. David Satcher, the 16th Surgeon General of the United States and the director of the aptly named Satcher Health Leadership Institute at Morehouse School of Medicine, whom you also saw in the introductory video, whom I know is incredibly focused on food deserts. And one thing that might seem completely improbable to all of us sitting here is that where we are right now at the La Quinta Inn is surrounded on 4 sides by food deserts. If you go to the USDA website now, you can type in an address and see whether or not where you are sits in a food desert. And we actually sit amidst multiple food deserts right now. 20% of low-income people who live in California don't have access to healthy foods within multiple miles of their homes, not even within the 1-mile circumference that we saw in the video. So we know that this is a pressing problem here in this neighborhood where we find ourselves in this state and certainly in our country. So David, could you talk about your pledge and then also talk about food deserts specifically because it's so sadly relevant?
Is that why it's called Palm Desert? I wasn't sure.
I don't know. You'll have to ask someone with a bit more local history for that answer. David.
Thank you very much, Chelsea. I was just listening to you and hoping that you would keep talking. You were really doing such.
Well, maybe after you, David.
Okay. But let me say that, first, I'm very pleased to be a part of this panel and to be a part of this conference again. When I became Surgeon General in 1998, after serving for almost 5 years as director of the CDC, I was told what they tell every new Surgeon General: you are now the nation's doctor. But I believed it. So I set out to develop a prescription for the American people, and I remember that President Clinton had asked me to represent the United States at a global conference on health promotion and disease prevention. So we worked to develop this prescription just in time for that conference, and it went quite well. We stood out because there is no other country in the world that has a Surgeon General. But I just wanted to say that on this prescription, of course, we, using data from the CDC especially, we talked about the importance of regular physical activity, and we were very precise about the minimum. We talked about fresh fruits and vegetables, avoiding smoking, responsible sexual behavior, and we talked about managing stress in our lives. And I must say that throughout the country during my years as Surgeon General, I really pushed this prescription. Later, I was asked by the World Health Organization to serve as a member of the Commission on Social Determinants of Health. There were 24 of us, and we went all over the world looking at how social factors were impacting the health of people in the world. From India, Brazil, Canada, Australia. We visited all of these places, and what really became clear was our conclusion, and that is that social determinants have a far greater impact on health outcomes than health care. And so since that time, I have tried to integrate concerns about social determinants of health with health care. Now, I believe very strongly in health care. It's been my career. I agree with Don Burrick, however, that when you look at the impact of behavior, that it's very clear that behavior has a much greater impact on health outcomes than health care. But what's also clear now is that there are social factors that influence behavior. And so when you have communities where there's no access to fresh fruits and vegetables, where it's not safe to stand out on the porch, let alone walk or jog in the morning, then we have to be aware of that. And so that's been our major concern. We have worked with communities now for 3 years. And what we've learned, of course, is that there are major barriers to access to healthy lifestyles, but many of the solutions also are in these communities.
Can you give us a few examples?
We have 3 leadership development programs. One, of course, is for physicians and public health leaders. But in the last 2 years, we've also developed community health leadership programs. So we invite churches and employers to recommend people to come and spend 12 weeks with us, 1 day a week, to help develop strategies for improving behavior in their communities. And we've had some really interesting outcomes. More recently, especially working with parents in a community that's 80% single parent, predominantly black, we have been able to dramatically engage parents in improving parenting, beginning with pregnancy and the development of the baby in utero. We have measured the impact of this, not just on the children, but also on the parents. And one of the most striking things, of course, was when we were able to show that depression in this population, where it's so common, dramatically decreased when they engaged in these parent leadership development programs. So we believe that it is possible to really promote healthy lifestyles and to help transform communities. One of our graduates lived in a community where, as I said, it wasn't safe to get out and walk. What she did as her project was to engage people in that community in developing modified neighborhood watch programs. So whereas they not only watched out for each other, they actually got out into the community and walked together and did things together. And she dramatically reduced crime in that community, but also made it safe to be physically active. So basically, we believe that we can work with communities. There have been programs where buses have taken fresh fruits and vegetables. I think Stephen Case in Chicago has demonstrated that, showing that you can use other strategies for getting fresh fruits and vegetables to people. So we have a major problem, and I believe that we should invest in solutions to these problems. I think the Affordable Care Act, especially the prevention agenda, allows us to do that better than we have before. And I'm going to close with this, but I think the key word, the most important word in the Affordable Care Act is probably incentives. You heard from the other panel about incentivizing certain forms of health care. We can also incentivize prevention and health promotion. And we have to do a better job in our schools, in our businesses, in our homes and communities in incentivizing. Our pledge is to continue to work with some of the more difficult communities in this country and to try to incentivize prevention and healthy behaviors, but also to promote leadership in those environments.
Dean, did you want to react?
Yeah, thank you, Chelsea. I want to build on the beautiful work that you're doing because there's this often pervasive idea that changing lifestyle is for affluent, educated people only, and yet you've shown and others have shown that when the incentives are aligned, that can change. One of the things I forgot to mention is that it took us 16 years, but we were able to get Medicare to cover our program, in part with President Clinton's help along the way, and want to publicly thank you for that. Because I didn't want this just to be for that way. Because I've learned, I thought if we just did good science, that would change medical practice, but I was wrong. That if you change reimbursement, you change medical practice and even medical education. And because Medicare is now covering our program, most other insurance companies are doing so as well. And then it creates a new paradigm of true health care and not just sick care, by allowing the doctor to get re-enchanted with medicine, by practicing the kind of medicine that involves not just the doctor, but a dietitian, an exercise physiologist, a clinical psychologist, a yoga and meditation teacher, a nurse, all working together as a team. And when we do that, we find that we can make much better care available at much lower cost. And instead of the managed care approach of trying to force doctors to see more patients in less time for less income, which is driving the best doctors out of medicine, we can create a new paradigm that's really based on the quality of care and not just the amount of care.
So, Dean, that's a perfect segue into something that was frequently discussed this morning, which is kind of in this ecosystem of government, federal government, state government, local government, private companies, philanthropic organizations, school districts, like the remarkable testimony we heard from the Coachella superintendent giving 18,000 kids an iPad and then asking for help to figure out what should go on that iPad to empower kids over their own lives and their destinies. What is the role of government, do you think, in incentivizing companies like Walmart or maybe even smaller grocery stores to go into food deserts, or to supporting other parts of the hotel industry to help make similar decisions, or in encouraging other marquee events or organizations like the PGA Tour to do what you've done, or to encourage the right research, or David, to ensure that there are safer alternatives for people to go and walk and exercise that may not be next door but aren't too far away in many of our cities. What is the role of government in encouraging what ultimately I think are the smart business decisions, but also are the right thing to do?
Well, I'm going to just start and say that, and women call for this regularly. Women make 80% of the healthcare decisions. Women continue to provision the home. Women regulate children's lives, their screen time, and are increasingly calling for physical education back in schools. So I think the direct answer to your question is it's necessarily going to be a partnership between local, state, and federal government, but clearly it's going to be in the consumer area. And my advisement to everyone on this panel is try to think like a woman, because she's going to be
easier for
she is going
Andrea
to be making those changes. Another good example we have of women in the 1960s and 70s, started by our National Cholesterol Education Program, so our federal government and our NIH. They challenged America's mothers to reduce saturated fat in the diet. And David will remember this. Women, through Women's Day, through Red Book, through TV and radio, reduced our consumption. Children, I remember I was a child, I couldn't drink whole fat milk anymore, and the butter went away, and there was no more lard. And the nation's cholesterol levels dropped 20 points, and heart disease fell at that time as well. So anyway, that's my take-home message, is think about women, because I think we're in the driver's seat.
So any other reactions? Yes,
Yeah,
Andrea.
I think in some cases incentives can be very helpful, but in other cases you have to understand the unintended consequences. And so, for us to...
What do you mean by that?
Well,
to you as a company, or to...
Well, just anything. I mean, we spend a lot of our time trying to get the right metric to measure the right progress to make sure what you want to have happen is actually happening. So I'll give an example in the trans fats. I think with the labeling of trans fats, that was something that brought awareness up, where people were, or manufacturers, all of a sudden were thinking about, if I have to report this out separately, that's going to be something that people are paying attention to, so I need to think about that. Well, one decision that was made with that is that you could label something as 0 if it had up to 1/2 of a gram, or 0.49 grams. And so I was actually hearing some discussions about, and if you add that to serving size and you have multiple servings of that, you haven't actually eliminated trans fats. And I was in some conversations, or heard some people talking about how they were going to move from 0.2 grams to 0.4 grams because they could get some of the taste back, but they could still report out at 0, and that was an unintended consequence. So when we came out with our decision about eliminating all the industrial produced trans fats, we told our suppliers we do not want to see partially hydrogenated oils in the ingredient statement. So that's just a very simple example of an unintended consequence by how you communicate or how you think about. Right. Something very beneficial happened. People were thinking about trans fats and they were working on it, but the way that it was stated, you have some unintended consequences that you have to pay attention to.
So incentives matter, but so do metrics. I want to go to the audience for questions in a moment, but I want to let David say whatever he was eager to say.
I actually want to go back to your question this morning about medical education and Dean's comments, because we have a major problem in terms of medical students not going into primary care, even though we're all agreeing that that's what we need. And I think the answer is pretty clear. We have not incentivized primary care. We have been paying people to do procedures for volume as opposed to value. If we can change that and really incentivize primary care, it's going to take a while, I think we'll see a change. But we've got to send the right message to medical students. They come to medical school wanting to do what the country needs, but they're discouraged when they see the rewards that go to primary care as opposed to other areas. So I think the government can incentivize.
I totally agree with what you're saying. And just as a small example of that, we've been contacted by thousands of healthcare professionals who want us to train us in our program with no advertising, no PR, nothing, just because they heard that Medicare is covering it. Because it's a way of creating a new paradigm of primary care medicine where you actually can spend time with patients, working with these other healthcare professionals, dietitians, exercise physiologists, yoga teachers, and so on, to leverage your time to get more income for you, and because of the Affordable Care Act, where you're reimbursing not by procedure, but by diagnosis, the incentives get turned on their ears, so now it actually makes economic sense as well as medical sense to do the right thing for your patients.
I think we have a question on the other side of the podium. Yes, and could you please tell us your name?
My name is Haley Thomas, and I'm with the Alliance for a Healthier Generation. And I have a question for Ms. Thomas. So what you're doing with Walmart, it's really great, but I noticed that there are fast food restaurants in your stores, and it's kind of like, you know, do you go for the fruits that are better for you, or do you go for the kids' meals and things like that? Especially for kids, I know it's a struggle. So.
Right, thanks, Haley.
Thank you, Haley.
So in the discussions that we've had with our customers, they want to still be able to have choices, and there are occasions where they want to make a choice that's more indulgent, and what we've been focused on is making sure that they have a choice in understanding what's healthier as well. And so we have been spending time trying to educate on fruits and vegetables, and if you go into our stores now, we have the Great For You icon on the fruits and vegetables. We talk about the benefits, the health benefits, and then a simple way to pick and prepare. And so we're trying to make the choices that our customers make easier for them to make a healthier choice. We're not removing choices. We still sell birthday cakes and ice cream so they can celebrate their birthdays and things like that. But we want them to make sure that they can see how to make the healthier choices.
So, Haley, I live in New York City, where our mayor has decided that certain choices should be more expensive than other choices, and currently has a proposal pending that would eliminate from fast food restaurants, from convenience stores, from regular restaurants, from movie theaters, from everywhere, sort of supersized sodas. You know, he says that you can always just buy more of the smaller size sodas and it can add up to a big one. But that he thinks that default choice should no longer be an option. Before I take another audience question, I want to take a quick poll of the panel. How many of you, A, believe in taxing unhealthy choices, or B, removing certain unhealthy choices? How about on A, taxing unhealthy choices?
And unhealthy choices?
Taxing unhealthy choices? Okay. So,
Could I reframe that for a second when you get done?
well, sure, can I ask how many people think that certain unhealthy choices should be eliminated altogether? Or do you believe that people should always have choices and that the onus then is on those of us who care about this issue, hopefully all of us in this room, ensure that people have the right information to make the right healthy choices for themselves and their families?
But see, I think the issue...
Hold on.
Sorry.
So, quick poll.
Quick one. Just real quick.
No, quick poll.
Oh, shoot,
quick poll.
Sorry,
How many of you think that certain choices should be eliminated altogether? Anyone?
Well, tobacco for children, I think, should be eliminated altogether.
Well, that's a good one.
Yeah.
There's a few.
What do you think?
There's a few
There's
things
a few
that
things.
should be
Such
eliminated. I think tobacco for children, obviously. You know, drugs, over-the-counter drugs need to be more carefully regulated, and our narcotics need to. We need to rework this
Mayor
prescription
Bloomberg
drug
will be
problem.
so disappointed that none of you agree with his 16-ounce soda ban.
I agree with it.
Yeah, so David, he has one panel vote. Dean?
But see, I think it's the wrong question, because the real issue is going back a step to the farm bill itself. 8 or 9 years ago, I worked with the CEO of McDonald's to get salads on the menu. That came from spending years with them to do that. The problem is because of the perverse, talk about unintended consequences, the perverse incentives in the farm bill make, the salad, it was $6.95, the burger's 99 cents. So if you're on a fixed income, you get a lot more calories for your dollar by eating junk food because the food doesn't really price into it, the real cost of it, because in the farm bill, those things are so heavily subsidized.
That's partly why I asked about taxation.
But I don't think we need to add the tax there. We just need to remove the tax incentive on the other end.
A different question, but yes, Ryan, you wanted to.
Yeah, actually, I had 2 points to the question on, if we have fast food in Walmart. I remember watching it was an interview, and it was the CEO of Burger King, and he came out with, at that time they were coming out with the triple, quadruple, gonna kill you Baconator. I mean, it was just this amazing burger, and somebody asked him, they said, don't consumers want salads? Don't they want a more healthy option? He says, well, no, not at all. That's why we have the Baconator, so that they can have the choice. If they want a salad, we have a salad. Now, I think really where you're going to see a difference is, and I was actually in an Applebee's recently, and they have now gotten on the bandwagon with listing the caloric intake and the carbs and the fat and what exactly you are eating in their restaurants. And I will tell you, I'd actually made a change in my choice from the size of the size of the steak I was going to eat from a 10 to a 6, realizing how much more fat was in it. So I think that's where really can make a difference.
Ryan, we have calorie labeling in New York City, and what the research has shown is that it actually is influencing the drink choices that people make, but not the food choices yet. But we only have a few years of data, so we'll see what happens in the future. David?
We should just not forget that 80% of, I believe, Medicare expenditures are for chronic diseases that are preventable. So whether it's Medicaid or Medicare, we are paying a great price for unhealthy choices. So if we can influence them by taxes, I think that's appropriate.
I think we had a question down here. Yes, sir.
I'm the chairman of Tenet Healthcare. We're going to have millions of people that are going to have access to healthcare system in the next several years. We talked about primary care physicians. We had to encourage more to go into primary care. What about the idea of supporting nurse practitioners as an important part of taking care and delivering health care to many, many people that come into the system?
Noel, what do you think?
No, I think that's critically important. And in the state of California, nurse practitioners are licensed, and they can prescribe, and they actually serve a critically important primary care base for us because we are so undersupplied for physicians. And we also are undersupplied for the number of medical schools that would be needed just to serve California. So I'm very much in favor of it, and we recently had a referendum as a licensed California physician, and I voted for it.
David, do you have anything to?
No, I agree. Donna Shalala chaired Institute of Medicine's committee that looked at the role of nurse practitioners and really recommend that, but it really showed what we could do by appropriately using nurse practitioners. But it also gets back to a comment from this morning about teams. And again, your question about how to better train physicians to be members of a team. And if we could take a team approach to healthcare, we could get much more out of our system.
Our nurse practitioners work under physician supervision using protocols. They didn't go to medical school, so they are very competent within their scope.
We have one last question from Twitter. What is the one thing that consumers can do that will make the biggest impact on their health? And maybe each of you could talk about this from your own perspective. Noel?
I think the biggest thing that's facing women right now, I'm just going to stick with my theme, is that young women now are smoking more than their mothers. They say that they're doing it for weight management purposes.
Is that true across the country, across different socioeconomic strata?
It appears to be. In fact, the most common time for young women to start smoking now is that first year in college. So I would ask us all to become, again, the personal is political, and we need to continue to regulate tobacco and tobacco products. It's a horrible thing.
Tim?
Well, I mean, I agree with heavy taxation on tobacco or making tobacco illegal actually would be fine with me. And I mean, it's just crazy. But from a consumer standpoint, I think you have to have some relationship with your quality of life and where you're going in life, and a lifestyle that includes eating right and exercise. And that just doesn't happen. So role models, people that you look up to, being educated about the relationship is important to allow them to make those choices. They just don't grow up, unfortunately, making those choices. When we started the First Tee program, people said, well, why would you want to try to bring golf to these kids who can't afford it in these communities? Well, what we found was that they get into a program and they start to develop role models, and all of a sudden their life changes. And if we can use that same formula to get kids to think about being the next Gary Player, the next Tiger Woods, the next Rory McIlroy, and it goes across all sports, you know, the NBA guys should be talking to kids in communities, and they do a lot, about if you want to be like this is what you got to do. And
even if you're not the next Tiger Woods, you're still going to grow up being a healthier person than you would be if you didn't have that aspiration.
And so, and as far as the government goes, if we're looking at this stupendous cost of not changing, and we tax to help make the change, it's a twofer for the fiscal problems that we face. And I just think we got to have a broader vision and get aggressive about tackling this problem. I haven't heard anything in the last 6 months on the debate about whether I should pay more taxes versus whether we should put an age limit on Medicare. I haven't heard anything in that debate about concrete steps to change behavior that we all recognize and everybody talks about as 75 or 80% of the problem.
Dean, quickly.
Walk, meditate, eat a whole foods plant-based diet, love more. All those things really matter. But I think we need to get away from fear-based approaches or punitive approaches, because fear is not sustainable in any activity. For the short run, yeah, but not for the long run. What we've learned through doing this for decades is what's sustainable is feeling good. And because these biological mechanisms are so dynamic, when you change your lifestyle, your brain gets more blood, you think more clearly, you have more energy, you can actually grow so many new brain neurons, your brain gets bigger, your skin gets more blood, you don't age as quickly, your sexual organs get more blood flow like Viagra does. Those are the things that really make a difference, is the quality of life, not just the fear-based approaches that are trying to scare you into changing. Fear of dying is not sustainable, but joy of living is.
Ryan?
I really think the one thing that consumers can do differently is understand what is healthy for them. And I know that the government releases a lot of information on body mass index and where you're supposed to be. But I think in speaking with your primary physician, you need to understand what is a healthy weight for you, what is a healthy cholesterol for you, because not everybody is going to have a 5% body fat and be able to run a marathon in 5 minutes. It's not going to happen. But in order to get long-term results, we need long-term changes. So educating yourself on what is good for you will really be the first step.
Andrea?
Yeah, I think people need to just make small changes and keep working at it and not get overwhelmed by the enormity of it. If you ate more fruits and vegetables, if you didn't drink your calories, if you made a couple of simple choices and then made that work and then move on to the next thing, then I think people would feel a little bit more encouraged and it would help them take charge of their health.
David?
If I had only one, I think it would be physical activity, because I think
what Don was talking about this morning. I mean, walking 30 minutes.
Right.
4 days a week was the best prescription that he could give almost any patient.
Even people who are overweight/obese who are physically active on a regular basis are healthier than people who are not physically active. Even people who smoke, and I really hate to say this, and are physically active on a regular basis are often healthier than people who are not active. So I would say physical activity.
Well, terrific. Tremendous thanks to my panelists. We talked about so much. We didn't talk about other threats to healthy lifestyles, which I know will come up later, the overuse of prescription drugs, the use at all of illegal drugs, guns, which clearly have been front and center to our recent national conversation. But we did talk about so many things that might seem so quotidian but aren't simple. How to eat healthier foods, how to walk more, how to have patience, how to think positively in those changes so that it does become sustainable for yourself and your family. Thank you all for all the work you're doing. Thank you for joining me today, and I hope you will all come back next year.
Thank you, Chelsea.
Thank you, Chelsea.
And before we break, I want to invite Lorena Garcia and Reed Alexander, who were here last year with us and made a really exciting commitment and also gave us some fantastic food. And I'm really looking forward to their update and their new commitment. So thank you both for coming back and joining us.
It's great to be here. So nice to see you. Yeah, absolutely.
Maybe you'll hug too. It's a prerogative. Thank you.
All right. Well, hello, everyone. Lorena and I are so thrilled to be
Hello.
here.
Super thrilled.
Absolutely. Well, we're very excited. Of course, big thanks to Chelsea, President Clinton, the Clinton Foundation, and the Alliance for a Healthier Generation. In the past year, we have had the chance to team up for a really exciting collaboration, and we both have been in the kitchen, right?
Very much so. Cooking our storm off, right?
Absolutely. A special menu of healthy recipes launching, now being cooked and served in retrospect every day to 30 million students in 15,000 schools across the country, alongside great names like Rachel Ray, Richard Blaze, and of course Lorena, who I am so privileged to be here with.
Thank you, Reed. Well, for me, it's been just a fantastic journey, and I cannot be happier to be here again, starting last year when we did our commitment, of course, to not only create recipes for the entire school boards across the country, in which actually yesterday came out to the national level. I started this creating recipes in Miami locally, and now finally we got it nationally. But the best thing, I was able to build the courage to participate in a competition that is called Top Chef Masters. Thank you. You go, girl. Well, through doing this, right, I did incredibly well. And I not only raised money for the Alliance, but I am happy to report that for the first time, we were able to create the biggest awareness in visiting in social media for the Alliance for a Healthy Generation. And I couldn't be happier to do that. We had a lot of traffic through Facebook and Twitter, and that to me is as important as actually raising money. So I'm here. I know that we have a video that I'm actually shaking to see what do we have. Let's check it out.
A concrete outcome from the Clinton Foundation's inaugural Health Matters Conference was to build on efforts to improve school food. iCarly star Reed Alexander and world-class chef Lorena Garcia committed themselves to working with the Alliance for a Healthier Generation to create healthier school meal recipes.
I made a commitment that I would team up with the Clinton Foundation and the Alliance for a really exciting initiative in 2012 that we launched nationwide. I would create a special menu of healthy and delicious recipes, which today are now cooked and served in our more than 15,000 schools and available on a daily basis for up to 30 million students. So it's a really exciting initiative and a campaign that I'm thrilled to be a part of with such a great reaction on the ground.
That's the amazing work the Alliance for a Healthy Generation is doing, is I'm able to work with them through my program, Big Chef, Little Chef, in which I create recipes through the program. I give them to the Alliance, and they go through all the different regulations that they need in order to be able to be fitable for the school.
Founded in 2005 by the Clinton Foundation and the American Heart Association, the Alliance is working to reduce childhood obesity. It's a goal shared by Lorena Garcia's Big Chef, Little Chef program, through which she teaches kids, parents, and school cooks about healthy, tasty food.
We need the kids and the parents everywhere across the country to understand the basics of cooking, the basics of ingredients, the basics of simple recipes. That to be healthy doesn't mean that you have to be on a diet and it's not flavorful. It can be flavorful, it can be fun, it can be fast, it can be in a low budget.
For Reed Alexander, there's a personal resonance.
And I understand the importance of eating healthfully, especially because this is an issue that has a lot of resonance that really hits home for me. I was an overweight teen with a family history of heart disease and diabetes, and I knew I needed to lose weight and grab health by the reins.
Recipes and other resources can be found through the Healthy Schools Program section of the Alliance's website, healthiergeneration.org.
So I'm happy to present this check, Ginny, for the Alliance for a Healthy Generation for $27,500 through my encouragement on Top Chef Masters. Thank you, Lord. Thank you. Thank you so much. Appreciate it.
Ladies and gentlemen, please welcome Tom Colicchio.
Hello, how are you doing? When I was asked to come out here and speak and do a menu for today's lunch, it just kind of dawned on me that the President Clinton, who I guess was the poster president for eating junk food, if he can make a change in his life and go to a vegan diet, then I think a lot of us can too. And so the question of health, and health matters, and we all know it matters, but can we really be healthy when the system by which we use to produce food is not healthy and is broken? Our current food system is unfair to workers, it's cruel to animals, it's detrimental to the environment, and it's bad for our health. Our food system relies on antibiotics, pesticides, and ammonia-based fertilizers, and it favors monoculture to biodiversity. It's actually created for maximum production and profit, and not really for our health. For instance, 75% of the 20 million pounds of antibiotics that are used to produce livestock are used for non-therapeutic reasons. 75% of the 25 million pounds. The resulting is a decrease of effectiveness to human medication by creating antibiotic bacteria like MRSA. And while we are growing more food than ever before and producing more than ever before, we still have a growing crisis in this country on hunger. Currently, 46 million to 48 million families are people are food insecure, including 17 million children. And so this is a big problem, but the problem that results from this is $113 billion to our healthcare system. A total of $160 billion overall. So by helping to cure hunger, we can actually reduce the cost of our healthcare system. And of course, healthy food is available to all those who have a desire and the pocketbook to afford it, but healthy, nutritious food is a human necessity like water and air, and it should be available for everybody. We need to move to a more sustainable way of producing food. We need to satisfy human food and fiber needs. I should put on my glasses so I can actually read this. We need to enhance environmental quality and natural resource base upon which agriculture economy depends. Make the most efficient use of non-renewable resources and farm resources where appropriate natural and biological cycles and controls. Sustain the economic viability of farm operations, enhance the quality of life for farmers and society as a whole. So the question I'll leave you with before lunch is, can we continue to abuse pesticides, ammonia-based fertilizers, and GMOs to produce food without hindering the future generations' ability to produce food? Thanks. You know, part of the reason I agreed to do Top Chef when I agreed to do it, because I kind of really wasn't interested in doing a reality TV show, but I decided to do it because I knew it would give me a soapbox, and so I decided I'd use that soapbox. I also want to thank the California Endowment for sponsoring our lunch today, and we have a great menu set up. First course is some sliced raw vegetables, including fennel, some watercress, radishes, cucumbers, all dressed with a yogurt and lemon vinaigrette. And then we have a braised black sea bass with some roasted peppers and spinach and a little very light lemon vinaigrette. And then after that, we're doing a panna cotta. And after you're done with the panna cotta, you're not going to believe that there's zero fat in this dish. Anyway, thanks for coming out, and I think we're going to move on to the lunchroom now. Thank you.